Hello, good afternoon. My name is Dr. Trudy Ufondu of Snowspirations Global Health Solutions. Thank you so much and welcome to this evening's YouTube live stream clinic. Today we're going to focus on women. So we're going to talk a lot about this. We're going to look at how you can actually know your fertility index. So how you can check your fertility as a woman. We're going to look at pretty much 5 different ways. There are so many things we can talk about this, but we're going to focus on 5 important ways on knowing your status as a woman. So when we talk about fertility, we are actually looking at the totality of this important female reproductive system. How can we know where you stand based on your age? What is the state of your ovaries? What's the state of your womb? What's the state of the womb? What's the state of the cervix? What's the state of the vagina? So all these structures must work together in order for you to be a mother. Now, it's possible you've been having this problem for a long time. They've told you a couple of things, and probably you're still trying to figure out where you stand. Or it's possible you don't really understand the different mechanisms and different tests which we can use to know where you stand. Please, if you are desiring to be a mother and it's not working for you, regardless of your age, you need to be in this clinic. And I'm going to start. So we're going to quickly look at things you need to be conversant with. Then after that, I'm going to take care of your questions, okay? So thank you for coming. Now, generally, if you and your partner are trying to have a baby, but you haven't been able to have this big dream of having your family complete, of having kids running all over the place complaining. Like this evening, I just came back, I picked the kids from school, and I had to go and sort them out with their food, then help Zara, then help Dumeje, and I'll still have to go back to Zara to help her do her homework. Now, when your dream of starting your family with your partner is not happening, it's okay to wonder if you're going to go for specific fertility test. And the answer is what? Yes. In our group, SGHS, Snowspirations Global Health Solutions, we recommend you check with your doctor if you are having regular sex without birth control for 12 months. So if you are practicing PPP, pray, play, practice, for 12 months without birth control. So you're not on Postin or you're not on any of those oral contraceptive pills. You are not on any contraceptive. After 12 months, if you are under 35, if you don't have a positive pregnancy test, it's important. We recommend you see a fertility specialist. Now, if you are above 35 and you've also done the same, you've prayed, you've made love 48 hourly, you're practicing, and after the end of the 6th month, if you are not able to have a positive pregnancy test, you have to escalate. Now, the point I'm going to make now is the most important thing for this clinic. It's important that both of you go for testing together. When you want to start your family, fidelity is important. Honesty is important. Keeping it real is important because your lifestyle in the past, your current lifestyle, your habits, and a whole lot of things can affect the ability of you starting your family. So it's important you go for this test together. So it's not a situation where the man will tell you, oh, I've gone for my sperm test, and he will just give you any result out there. We have to be very, very conversant, and we have to be sure that you're doing the right things. Now, what are the common reasons that will make you to go seeking help from a fertility specialist? If you're 35 years and older and you've been trying for 6 months, or if you have a diagnosis, maybe you have endometriosis, maybe you have ovarian cyst, maybe you have polycystic ovarian syndrome, maybe you have fibroids. If they gave you any diagnosis from your OBGYN, it's important you seek the help of a fertility specialist if you want to start your family. Remembering that it's not all women that want to have kids. There are even some women that will marry and they just want to be by themselves. Some of them even want to go have dogs instead of having kids. So it's all about choices. But if you want to start your family I want you to focus on age 35. It's very, very important. So, couple of things you need to focus on. 3 important reasons. 35 years and above, no baby, no pregnancy, test positive after 6 months, escalate. 35 years and below, after 1 year, escalate. Diagnosis of any gynecological problem from your provider, go immediately. Now, when you go to see your doctor will ask you so many questions. If you are under me, you know I love asking questions, right? So my intake form has about 27 questions. When we are asking you all these questions, we are trying to know about you and your partner. So we're going to ask you about your medical history, including your long-term medical conditions. For the men, we're going to ask you about your surgeries. Have you had any inguinal surgery? Have you had appendectomy? Have you had any injuries in the past? We are also going to ask the women. So asking you about your medical history and your surgical history is important. We are also going to ask you about the medicines and the drugs you're taking. We are going to ask both of you if you smoke, if you drink alcohol, if you eat or drink things like caffeine, if you use illicit drugs. We are trying to see how all these things can affect your ability to become pregnant. We're also going to ask you what you do. So some men work in industries that have chemicals and toxins and radiations, which can affect your ability to become a father, which can affect your ability to become a mother, because the egg and the sperm are very sensitive. So whenever you are exposed to things that will harm them, they can affect your ability to become pregnant over time. Now, we are also going to ask you about your sex life. So if you notice, we love asking about all this. So we're going to ask you about the frequency. How often do you have sex? We're going to ask you about the history of your birth control use. So if you're someone that abused Postinor in the past, or you just used it recently, or you used any contraceptive recently before you guys started wanting to become pregnant, we want that history. We are also going to ask you about your sexually transmitted diseases history, both in the past, both now, and anything you feel you need to tell us, that's the time to tell us about your sex life. We're going to ask you if you're having problems in initiating sex, if you're having problems in satisfying each other. We're going to ask the men if they're having premature ejaculation, if they are having poor erectile function. So we're going to ask you every single detail about your sexual life. Now, we are also going to ask you, either separately or together, if you've had sexual contact outside your relationship. It might be difficult, but we need this. Now, when we are done doing all these particular specific tests, we are also going to ask you about your current status regarding your period. So we're going to ask you if you've been pregnant in the past. If you have been pregnant in the past and currently you're not able to become pregnant, you have secondary fertility. If you have never been pregnant in the past and still up to now you haven't been able to achieve pregnancy, you have primary infertility. So we want to establish if you had pregnancy achieved in the past. Then we are also going to ask you about your period. How often you have your period. How many times you've had your period in the last 1 year. It's important that a woman in her reproductive cycle should, at least out of the 12 months in a year, you're supposed to at least have bled for 9 months out of them. We are also going to ask you about the regularity of your period, whether you're having missed period, whether you're spotting between periods, whether you're having any form of issues in your whole cycle. We are going to ask you about the consistency and the flow, whether your period is coming out in scanty form or is coming out in clots or is now heavy. It used to be little, now it's heavy. Anything related to your period, we're going to ask you that. We are also going to ask you the specific birth control you're using. We are going to ask you if you have seen a fertility doctor in the past. Every single question we are asking you will help us to understand your individual situation. No two women can have the same medical history. No two women can have the same surgical history. So when you go out there and your friends are telling you they use Clomid, they did this, it might work for them, it might not work for you. Now, when we come to the infertility test, specifically for women, so today we're going to talk about women. At some other time, we're going to talk about men. There is no singular best test for infertility. Most times we have to look at a variety of ways of problems. So there are so many tests we might want to do so that at the end of the day, we're going to look at them holistically to arrive at a particular diagnosis. So there is no one particular test that once we do is going to be best. So some women will require to go for pap smear. When you're going for pap smear, we are taking a little sample from the cervix and we're putting it under the microscope to see if there are changes which might mimic pre-cancer or cancer. If we have that, we're going to keep an eye on that because anything related to this can affect your ability to become pregnant. Most women that might be predisposed to having cervical cancer are women that have been exposed to HPV, human papillomavirus. So when you're going for your pap smear, we are keeping an eye on the changes in the cervix. Once it's discovered on time, we can begin to apply our treatment modality. Now, most women will need to go for ovulation check. Ovulation is a process that every singular woman must pass through before you become pregnant. Ovulation simply means the process of releasing the egg you already have. So we're going to take you through a couple of ovulation tests. Number one, we're going to use Ovulation Test Kit, which you can buy over the counter. When we are doing that, we are looking at the LH, luteinizing hormone. So we discovered that just about the time you are ovulating, when we check the urine level of your LH, it's going to be very high. So if you noticed that every other thing is consistent, and anytime you notice a high rise in the LH when you check with your urine, in next 24 to 48 hours, if everything goes okay, you're going to ovulate. And when you ovulate, when your partner meets you about that time, you're going to become pregnant. Now, we also need to look at the progesterone level. Progesterone level is also a very good indicator to tell us if you are ovulating. If we have an increase in the level of your progesterone in your body at day 21, is an indication that you are likely doing what? You are ovulating. So checking for ovulation is very important. Now, there are a couple of other things we can also do to confirm if you're ovulating or not. You can check your basal body temperature. So if you wake up in the morning and you check your first body temperature in the morning, you will notice that if it goes up within the time you're supposed to be ovulating, the likelihood you're ovulating is very, very important within that time. It's important you check this in the morning. If you notice a pattern, if you pay attention to your body, you can notice a difference, which can tell you if you are ovulating or not. We also want to look at the thyroid hormone. Thyroid hormone can tell us if the whole body metabolism is working okay, so we can focus on important things. Now, when we come down to the reproductive organs proper, remember the important reproductive organs in the woman is what? The vagina, the cervix, the womb, the tubes, and the ovaries. So we're going to have an extensive, detailed investigation of the womb, the tubes, and the ovary. Very, very important. We want to make sure that everything is going okay. Number one test we can use to check the tube is what we call HSG, hysterosalpingogram. So this is a special type of X-ray. When we want to check your tubes, we push a fluid through the vagina to pass through the cervix. And when that particular fluid is going through the womb and getting to the tubes, we are going to take a special picture of the X-ray to see if your tubes are open or not. So your HSG is a very, very important test in finding out if you are fertile. If you are fertile, by the time we pass the fluid, it's going to pass through. If it's blocked or if it has any adhesions, when we pass the fluid, it's going to have a spillover. So if it's not going to go through, it's going to splash. This is very, very important. HSG is going to help us to know about the state of the tubes, to know if they are blocked, to know if you have any defects in your womb. So HSG is normally done when you are not bleeding. Please listen to me carefully. Make sure you check your pregnancy status before you go for any of this investigation. So a pregnant woman is not supposed to go for HSG because guess what? If you are already pregnant and we are putting any pressure inside the vagina and inside the cervix, we are likely going to help you to lose that pregnancy. So it's important you know the status of your pregnancy before you go for HSG. Now, the second test we can run is Transvaginal Ultrasound. Transvaginal Ultrasound is going to help us to look at the womb and also the ovaries. If we notice any problem, we're going to see what we can do to fix it. If we notice any fibroid, any polyps, any cyst, then we're going to know exactly your chance. So Transvaginal Ultrasound is also another important test we can use. Also, some women might need to go for hysteroscope. Anytime we mention hystero, we are referring to the womb. So hysteroscope simply means passing a flexible tube with a camera through the cervix to take a good look inside your womb. Very important test for some women. Now, some women might also have a need to do what we call laparoscopy. In laparoscopy, we make some tiny cuts on your belly. Then we insert the tool with camera inside your womb to see if there are any problems inside the womb, to see if we can discover endometriosis or any problem in the pelvis. Laparoscopy might be indicated for some women. Not all these tests I'm talking about you will need to do. Now, furthermore, we are going to run some blood tests. Our blood test specifically is going to help us to check FSH. FSH is a very important hormone that can indicate your fertility level. When women are getting older, their level of estrogen will be coming down and their level of FSH will go up. When we notice that your FSH is very high, it likely means that your fertility is low as a woman, especially if you are above 35. And we notice that your FSH is doubled or tripled and your estrogen level is reduced and your AMH level is low. If we check this FSH level on day 3 and it's very high, it's an indication that you're likely having problems with your fertility. That means your fertility is reducing. Now, some women will also need to go for what we call clomiphene citrate challenge. That's your clomid. Now, when we are doing this, we are checking the level of FSH, and within a specific time, you're going to take clomid on the 5th through the 9th day of your cycle. But before then, we would have checked the level of your FSH on day 3. Now, by day 5, you start taking clomid. You take it 5, 6, 7, 8, 9. On the 10th day, we check your level of FSH. If we discover that your FSH is high at day 10, when we've given you clomid challenge, is an indication that you might likely have difficulties becoming pregnant. Now, we also need to look at the AMH, anti-Mullerian hormone. Very important hormone that will tell us about your ovarian function. Very, very important. When we are checking your AMH level, we are checking your ovarian reserve. Your ovarian reserve is going to tell us if you still have eggs. How many of them are still of good quality? So it's very, very important. Unfortunately, when your AMH is very low, it's an indication that you have low ovarian reserve. It means you are likely going to struggle to become pregnant. Remember, it's a struggle, it's a challenge, but you can still become. Now, what's the bottom line? You may not need all these tests, but there are specific ones you might go for. Your doctor can discuss with you, and we can advise you on the best way to go about your situation. Your situation is going to be based on the outcome. After you are done testing, about 85% of couples will have an eye there where their fertility stand. So assuming you're 45 and we discover that there are a couple of things we need to do fast, you're gonna expedite. If you need to go for IVF, if you need to go for IUI, if you need to go for donor, if you need to go for donor sperm, then you do that. So knowing about all these tests is very important. Now, there are a couple of other important tests we also need to run in a woman. We need to know your blood group and your antibody screen. Very, very important. Your blood group is specifically important because of what we call ratios incompatibility. So if you happen to be negative and your partner is positive, when you have your first pregnancy, that baby can be exposed, you can release antibodies. Now, subsequently, if your partner begins to still be positive, which is permanent, and you're negative, your body can build soldiers that can attack your baby. So knowing your blood group is very important. Now, we also need to check your rubella, antibody status. We need to check for a couple of other sexually transmitted infections, especially syphilis. The reason why we're checking syphilis is because when you have syphilis and you eventually become pregnant, it can affect the life of your baby. It can cause a lot of complications. We also need to look at the urine test to make sure you don't have UTI. We need to rule out a couple of other viral infections like hepatitis B, like HIV, and extensive workup. I've already mentioned the pap smear. In some women, we also might want to look at vitamin D. And we also importantly might want to look at your hemoglobin to check your genotype. So these are basic things important in a woman if you want to know your status regarding your fertility. Very, very important. If you are desiring to be a mother, if you haven't done any of the tests I mentioned, if you don't have a fertility specialist, this is a very good opportunity for you to come in. So we can help you in this group. You can subscribe, you can attend our classes, you can show up every day in the clinic. Personally, I run 2 clinics every day. I run one during my break time, then I run one every night. Lately, it's 2 clinics, 2 solid clinics. There is no way you will show up and your life won't be better. Okay, so thank you so much. Please, I'm now going to open the floor to take care of your questions. So please ask your questions in real time. If you have any question, please go ahead and ask. I'll provide you feedbacks. Okay, remember we were talking about 5 ways of ascertaining a female fertility status. So please ask your questions. Yeah, thank you so much, Ebenezer. Please ask your questions. I'm waiting. And remember, we have a big event coming up on the 26th. We are going to talk about gender selection. Gender selection. I understand some people want to have boys, some people want to have girls, and it's possibly causing some problems in your family. There are ways you can have boys. There are ways you can have girls, but you need to know the right knowledge, okay? What fertility issues does progesterone help to address? Very smart medical school-based question. So you see, the cover of this womb, this beautiful lining, is called the endometrium. There are 2 hormones that maintain the endometrium. But of those 2 hormones, your progesterone is the one that will be responsible for the thickness. So when your progesterone level is low, the thickness of the endometrium will not be strong enough. So it cannot support pregnancy. When that happens, implantation will fail. So if we notice that your progesterone level is low, we give you progesterone supplementation so that the foundation of this womb, which is called the endometrium, will be strong enough to support your pregnancy. If your progesterone level is low, you are likely going to have miscarriage or stillbirth. Know the difference between miscarriage and stillbirth, which is 20 weeks. So your progesterone is very, very important. It's one of the most important hormones in pregnancy. Very, very important. Okay? All right, thank you so much. If a woman thinks she's pregnant, how long should she wait before seeing an OBGYN? The first thing to do, if you think, you see, pregnancy is all or none. It's either you're pregnant or you're not pregnant. So what you need to do, I want to believe you're very conversant with your cycle, right? Now, if you are anticipating your period on a particular day, after 7 days, that's 1 week of not seeing your period, please go and run your urine pregnancy test. You can buy it over the counter. When you've done that test, if you are positive, that means your beta HCG, beta human chorionic gonadotropin, that's the so-called pregnancy hormone. If it shows positive, you can rejoice a little bit. But after your positive urine test escalates, go and run the blood test. The blood test is more superior to the urine test. The blood test is both a qualitative and a quantitative test. Your blood test is supposed to show us that the beta HCG will be doubling every 72 hours. When you have confirmed you're pregnant through the blood test, don't stop there. Pick your phone, call your doctor, schedule an appointment, then get your ultrasound as soon as possible. Ultrasound is the clinical evidence that you're pregnant. Once it's confirmed your ultrasound, it's good. It's showing that the baby is existing inside your womb. You are pregnant. Then you register for your ANC immediately. We have a special clinic for all pregnant women in our group. It's a group consult. We'll encourage you to be there if you're pregnant. We want to work the whole 9 months with you, okay? Very important. So as soon as you are confirmed pregnant through urine, call your doctor, go for the blood test. When the blood test comes good, call your doctor and go for ultrasound. Once your ultrasound is checked and you're pregnant, then begin your ANC. How long does health impact? How does health impact fertility before conception? Very technical and very smart question. You see, we become what we do when we were growing up and right now. So if you had a lot of rough lifestyle, if you had a lot of abortions, if you had a lot of infections, and because of all those abortions and the infections that they were not treated properly, they can affect your ability to become pregnant. They can damage your tubes, they can damage your womb. You can have what we call Asherman syndrome. So many women had illegal abortion. So in case of going for D and C, dilatation and curettage, they will scrape off deeply into the tissues of the womb. When that happens, when that cover of the womb is healing, it will heal with adhesions. When it heals with adhesions, sometimes you can have extensive Asherman syndrome. It simply means you have extensive adhesions affecting the surface that ordinarily pregnancy should occur. So your lifestyle growing up is important. When you're having your boy and girlfriend relationship and you have pain and you have itching and you have vaginal odor, anything that indicates you might have a problem, please don't be shy about it. Go to a gynecologist, because you can have gonorrhea, you can have chlamydia. We can treat it within 1 week. But if we don't treat it properly, it can damage your tubes. So you can have blocked tubes. It can damage your womb. It can damage your chance of becoming pregnant. Now, if you are not someone that is very active, if you eat everything out there, if you're not resting, if you're just careless with your life, it can also affect your ability to become pregnant. Okay, so what you do in the past, what you did in the past, what you're currently doing can affect your ability to become pregnant. Okay, very, very important. If pregnancy still has not been achieved, how long should a couple wait before repeating fertility test? This is a very, very important test. We normally advise 6 months. 6 months. So for this 2021, if your lab test it's older than 6 months, it's always good to go for a fresher current test. A current test will give us a current status. So a man might be okay in January, but by September, a lot of things might have changed. A woman might be okay in January, but by September, a lot of things must have changed. So if your last test is in January, by July, please go and repeat another test. Your test is going to help us solve a lot of problems. When we know the direction your test is going, we can know the direction we can guide you. So like I said, it's not all women that will require all the tests. So depending on your presenting complaint, depending on what we might be suspecting that might be leading to the infertility, your test will differ. Like if we discover that you guys are only making love during your ovulation, do you have a infertility problem? No. What do you have? Lack of lovemaking awareness. So we tell you to go back and continue practicing your PPP until you become. If we notice you're 25 years, you married in December, by January you're already freaking out and you're taking all the Clomid in the world, if you present to our clinic, what are we going to tell you? To go home and make love to your partner. So your age and the reason why you're having challenges will determine when and how we can guide you to do the right things. Okay? Should men stay away from hot bath? Now, Ebenezer is going to the male aspect of infertility. Yes, the reason is because the temperature in the scrotum where spermatogenesis occurs must be lower than the rest of the body. So God, I don't know the kind of God we have. When God was creating men, God created men to an extent that the testicles, which is contained in the scrotum, should hang outside the body for a particular purpose. The testicle and the scrotum must be lower in temperature to support the process of producing sperm. Now, when you increase the temperature in your groin by going to hot baths, by wearing tight-fitting boxers and pants and all that, by sitting in one place for long, by driving a long distance, increasing the temperature in your balls, if you do that consistently, if it becomes enough, it can damage the process of producing sperm. So men should avoid hot bath. It might not necessarily be one of the top reasons why you might have male infertility, but it's a factor. Remember, fertility is a very delicate process, okay? So be careful. Men actually should not be wearing any tight-fitting thing. If your penis is going to misbehave when you go out there, I don't know what to tell you. If you need to fly out, you fly out. But we don't subscribe to men imprisoning their penis for a very long time. When you come back home, make sure there is air circulating around your groin area. Very, very important. If you're a long-distance driver, please have brakes, stretch, and allow air to circulate around your groin. It's also applicable to women, but the heat aspect of it is more detrimental to the men. So men should also be careful. Matter of fact, very careful. Okay? Very, very technical and very important questions I'm getting this evening. So remember, we're talking about female fertility, how to check female fertility. and we mentioned factor 35. At age 35, that's the tiebreaker. When you have been trying to become pregnant, which you don't normally like using in this group, when you're believing to become pregnant, you're 35 years and above, you are making love to your partner 48 hourly, you don't use postinol, you don't use oral contraceptive pills, you're not using any contraceptive out there. When it's 6 months and you don't have positive pregnancy test, escalate. If you are below 35, when it's the 13th month and you don't have positive pregnancy test, escalate. We normally advise you to start on time. Now, if you are 50, you have to start like yesterday. So the older you are, the more the urgency, the more the need for you to start knowing your status as a woman. Very, very important. Okay? All right. Can a woman having an irregular cycle who missed her period still get pregnant? 100%. Now, some women might not bleed, but they are ovulating. The common denominator in becoming pregnant is ovulation. Some women will have all over the world irregular period. They can't even pinpoint, what their period is all about, but they are ovulating. So what's the key word in regards to our 24-hour lovemaking? To make sure you are increasing the fresh deposit of the sperm in your vagina, so that if you have irregular period, you're likely going to have irregular ovulation. So long as you are ovulating, you can become pregnant. So even if a woman is having irregular cycle and she's having missed period all over the place, she can still become pregnant by increasing the frequency of lovemaking. Simply by making love can improve your chance of becoming pregnant. So the answer is what? Yes, you can become pregnant. A woman that recently had a baby and she's waiting to see her period before she will start being careful can easily become pregnant shortly after having her baby, as early as 2 months, as early as 3 months, as early as 4 months. So imagine your baby being 3 months, then you're already pregnant again. So be careful. Babies should be planned. Pregnancy should be planned. If your economy can support one baby, please have one baby. There is no competition. Okay? So thank you so much. I believe we've come to the end of today's clinic. Ebenezer, please, can you quickly share the topic for tomorrow? And after this, please munch the sharing link and share this particular video to all our women. This particular video, it's what every singular woman that wants to become a mother should watch. It's going to help you. It's going to help your partner to understand better. When you understand better, you're going to change your attitude. When you change your attitude, you're going to change your practices. When you change your practices, you're going to change your perception. When you change your perception, you will become a mother. Earlier today, I posted a poll and I asked you guys specifically, how many babies do you want to have in 2022? It's a faith-infused poll. I don't want you just going there and claiming twins and triplets and you're not doing the right things. If you genuinely want to have twins, if you genuinely want to have boys, if you genuinely want to have girls, then please follow the process. There is always a process in everything. If you are having difficulties, follow the process. Everything in life is all about process. If you are having infertility, it might be 20 years, it might be 30 years, and suddenly you can complete your family. You can have 2, 3, 4 next year in one go. It can happen to you. You will think it's all over, but before you know it, you complete your family. But you need to put in the right words. You need to walk. You need to do your own part. You need to meet your partner. You need to have a fertility specialist. You cannot be looking for a baby in 2021 and it hasn't happened and you don't have a fertility specialist. It doesn't make sense. And you can also not be using money as an excuse. Money is important, but you need to do the right things. Okay, so tomorrow we're going to look at how to become pregnant with PCOS. Very important. Polycystic ovarian syndrome is a factor that can on its own stop you from becoming pregnant. So tomorrow we're going to look at how you can overcome polycystic ovarian syndrome and at the same time become a mother. Thank you so much, Kenneth. Thank you so much, Ebenezer. Tomorrow I'll see you guys. Until I see you, God bless you and enjoy the rest of your evening. Bye-bye for now.